Each doctor station consists of one doctor and at least one student translator or observer. Most of the time, multiple students would sit with each doctor to observe, help translate, and to learn diagnostic techniques. With 4 doctors participating in this part of the clinic, patients would be seated at one of 4 stations and would hand their data sheet from triage over to the doctor. Then, the doctor would introduce himself and begin asking more detailed questions regarding their medical problems and issues. Since we see a great deal of Haitian patients in our clinics, several translators fluent in Creole and French were also present at each clinic in order to help in particular cases. Some of the more common medical issues found in patients were chronic body pains, stomach parasites, fungal infections, and malnutrition. Dangerously infected trauma injuries, threatening childhood pneumonias, and numerous sexually transmitted diseases were also seen and treated. After identifying the problems of each patient, doctors would note and prescribe medications for each patient or family. After receiving their prescriptions, each patient was then directed to the pharmacy.
Alguien iba a traer
After leaving the doctor station, each patient would carry their data sheet, now completed with their prescriptions. Students would direct the patients to the pharmacy, which, depending on the village, could be in the same room as the doctors or in a separate building somewhere else in the village. The pharmacy team consisted of one doctor to oversee and double-check all prescriptions, and approximately 3 students to fill each prescription and to explain the critical dosage information to the patients through Spanish or Creole. The medicines packed in the morning at Crossroads were organized throughout the pharmacy room. Pill counters, fresh water for antibiotic suspensions, and dosage explanation stickers were used by students as each prescription was carefully filled and handed out. Students working in the pharmacy would personally hand each patient a bag with their medications and dosage instructions, as well as carefully and repeatedly explain how many pills or vitamins need to be taken and at what times. The final step was to ask the patient to then repeat the instructions back to the student to make sure they truly understood. Such attention to detail was critical, particularly with antibiotic medications which, if taken incorrectly, could lead to dangerous results or complications.
This is for cramps or for stomach pains.
Poor water sanitation and lack of dental care are common problems that lead to staggeringly high numbers of stomach and intestinal parasites, as well as decaying teeth and infected gums. Children are hit particularly hard by these issues, forcing them to constantly fight uphill battles against malnutrition and disease. The fluoride and deworming station of our clinics focuses on this problem by providing a strong anti-parasite medication, as well as effective fluoride treatment to prevent tooth and gum damage. The local children always seem eager to get the medicine, that is, until they actually taste it. The anti-parasite medicine is supposed to be banana flavored, but judging by most kids' reactions, it is anything but. The real tricky part of the station is with the fluoride treatment. If ingested, fluoride can severely upset the stomach, so it is essential that the kids gargle or swirl the medicine and then spit it out before they swallow it. Conveying this in a foreign language often proves very difficult, so it is up to our creativity and active demonstrations to get the message across. This is one of the most critical and beneficial stations in the clinic, and is always a student favorite each and every year. This year saw the introduction of a new and exciting aspect to our clinics, the Art Exchange Station. Created by one of our own student volunteers, the Art Exchange Station was the perfect opportunity to get to know some of the children of the villages, provide them the opportunity to show off their creativity and artistic skills, and to share some art from American elementary students with students from the Dominican Republic. Prior to our trip, students at neighboring elementary schools near Boston were asked to draw pictures to be exchanged with art that would be drawn by Dominican students during our trip. We brought hundreds of pictures with us and enough blank paper and crayons to allow every child we saw to create their own drawings. After kids had gone through the fluoride and deworming station, they were invited to go draw with their friends. After they had finished, we exchanged their drawings with the drawings we had brought from American students. The station was an enormous success, and its creator, Anjali, should always remember just how powerful her gift of art was to the children we saw. The Art Exchange Station has become a central aspect of our trip, and will be continued and emulated within other schools' Timmy chapters and our own future relief trips around the world. Another important first for this year's trip was the introduction of a public health station. Working closely with the art station, the public health team sang songs and taught the significance of washing hands and personal hygiene. While the public health station worked primarily with each community's children, flyers were distributed to parents of kids, highlighting effective methods to keep their families healthy. Dr. Bob Mellingmeyer, co-founder of Crossroads, is the head of the organization's medical outreach efforts. Either he or his wife Jana would travel with the group each day to the villages and clinics where they would be instrumental in achieving our goals. Dr. Bob, in addition to crowd control and overall organization, would lead the group on tours of each village during the lunch break. During these tours, the group would learn of the rich history and culture of the people of the Dominican Republic, and of the Haitian refugees who have fled their country in search of better lives. From densely urban to rural, the range of villages and towns visited by the group is broad. Each town offers its own unique histories and qualities, as well as its own public health and medical problems.
You know, it's funny, in the States, it's one thing I've seen in Latin America, in the States, you know, we tend to separate very much the rich from the poor. I mean, we got large spaces, as long as you can do that. Latin America, they don't bother. I mean, if you go to Haiti, you'll see $1 million house and right next to sugar shacks on both sides. And in this case, they don't bother that much. You'll see houses that are built just outside of here that obviously cost money, right next to the poorest person. They don't isolate themselves the way we do, but they somehow are able to ignore it.